Okay, today is July 5th, 2023. We're doing our in-service on admission, what we expect from our CNAs to accomplish or provide to our resident when we do a admission in skilled nursing. And the first thing we're going to talk about is communication and orientation assessment. So, which means that when a new resident comes in, we want to try to get as much information as we can from this resident. And the way we do that is we talk to our nurses, we talk to our resource nurse, the floor nurses, and we ask them, what the admitting diagnosis is. You might even ask their orientation level, their ability to swallow. Any information that you can get is going to help you take care of this resident later on. When the resident finally does come in, you want to communicate with the resident and monitor how they're able to communicate. Sometimes they're able to comprehend what you're saying, sometimes they don't. And sometimes they're able to make their needs known.
Hey, John.
And hey, how are you?
We're doing a self-report. You're on a...
Okay, going back, so we want to communicate with residents, assess orientation level. And the way we assess orientation level is we figure out whether they're oriented to person, time, place, and situation. And I think we kind of know how to do that now. We ask them, they're oriented, try to figure out if they're oriented to person. And then they know what the time is, if they know where they're at, and then also the situation that they're in. Okay? And then we just kind of note like their ability to communicate. Like I said, sometimes status post-stroke patient, they might be able to understand you with pictures, and sometimes they won't. So it's important to communicate that with the next CNA when they're coming in. Just say, hey, you know what, this resident, he's able to understand you, but you really have to, show him things, picture or something. You write it down or something, he'll be able to understand you. So communication is really important when it comes to these residents. Orientation of room and supplies. For this one, when the resident comes in, just orient them to their surroundings, which means that the call light system, you want to kind of orient them to how to call the nurse. That's the most important thing, is that if they need something, they should be able to push that red button. And if they're not capable of pushing the button, we have a soft touch type of button. We can switch to that. Orienting them to the room, who the roommates are, how to use the TV, bed remote, they can go up and down their bed if they're oriented. And then just the overall safety, how to walk around, how to call you, and not to get up on their own, all that. We also want to provide resident with basin that has, toothbrush, toothpaste, razor, shaving cream, lotion, mouthwash. Also, if they have a Foley catheter, you want to provide them with like a measuring cup, a cylinder of some kind. Provide the male residents with urinal if they're, continent. And if the patient also has a Foley catheter, you want to make sure that you communicate with them that we would be switching their Foley catheter to a drainage bag at night, and then in the morning they would be on a leg bag, right? The other thing is that vitals. When they come in, you want to take their vitals, their weights, and then you want to figure out their diet orders. Okay, check with nurse diet orders and liquid orders. Knowing their diet orders, you'll be able to kind of have a good view on if they ask you for a snack. It's mechanical soft. Obviously, you don't want to give them anything significant that would make them choke. If they have a diet order that is puree, then that is significant in nature in terms of like what you can give them for their snacks, because there's not a lot of puree snacks out there except for the pudding or something like that. Yeah. So also trying to figure out what kind of liquids are they able to tolerate. Thin liquids, thick liquids. As you know, we have a couple thick liquids. We have nectar thicks, honey thicks, and then we also have the pudding thick type of liquid. So we wanna know what they're capable of in terms of their swallowing ability. And then it's important to take their vitals when they come in. You want to get those baseline vitals, and then you want to note that on the matrix. So the other thing that we're missing is just acquiring the resident weight upon admission. A lot of times we're not picking up this weight for whatever reason. If a patient has had like a knee surgery or a hip, and it says weight bearing is tolerated, we can get this resident up, and get their weight. But if it's the order is not weight bearing is tolerated, then you would typically want to wait for a physical therapist to get them evaluated, and then you want to get these weights maybe tomorrow if it's late at night, after the admission is done. and have the physical therapist assess them and their ability to walk. Okay, mealtime and activities. Inform the resident regarding meal times, just as you're kind of, providing care for the resident. You're welcoming them in the room. Let them know what time meals are, and provide them with like a weekly menu. And also, just let them know what kind of activities we have, and we have a monthly activity schedule that we can also let them know. And then for confused residents, you wanna typically keep the bed low, because if they fall down, they're not putting themselves at risk for significant injury. Monitor for unsafe transfer and notify the nurse. If the resident is really a high risk for fall, we would put a bed monitor on there, a wheelchair monitor, but also the rest of the, and we would add them on the falling star list. Okay, and for these residents, our main concern is going to be safety when they're confused, and we want to redirect them and orient them as necessary. Okay, so it's a nice quick in-service, just kind of goes over. A lot of our CNAs now are brand new, and so I wanted to get some kind of in-service out there for you guys. We have this on YouTube too. So and some of the CNAs that really are like, hey, what are we supposed to be doing? And I didn't know we were supposed to be doing that. But also what I didn't add on here is that this would be the 6th. We also have the inventory list. So we want to complete the inventory list, and that is a list basically that we write down their jewelry. If they have glasses, you put that on. Dentures, they have it on, and it's just a list of things that they brought into the facility. If the next day they brought some more stuff in, we would add those on there, and it's at the very back of their folder, okay, in the charting folder. And so that's the most important thing in terms of, and that's the one I forgot actually, but getting their vitals, getting their diet orders, completing the inventory list, and bring that basin in complete with toothbrush, toothpaste are going to be the most important things for these residents. And that and then if a patient is confused, we want to make sure that this patient doesn't fall down within that first couple hours, because they need to be oriented to their room basically when they first come in. Okay, all right, let's go over this test real quick.
Okay.
I know some of you guys just came in. That's all right. Let's go over some of this tests here. Who should the CNA acquire information regarding new admits? Who should you be talking to? You got a new admit coming in, and you're just like, I need some information on this resident. Who should we be talking to?
The resource nurse or the LVN?
Okay, yeah, that's very good. So if you want the, and then it gives you quite a bit of option. If the LVN is busy on the floor, you can talk to the resource nurse. They should have as much information as the LVN. What a lot of times happens is that if the resource nurse has gone home, the one who admitted that patient, they may not have as much information. Okay, so the resource nurse in the morning or in the PM who did that admission, they're gonna have quite a bit of information.
Just a resource nurse or LVN?
Resource nurse did admission. The LVN on the floor should have gotten some, report from the previous LVN as well. Okay, what important information should the CNA ask for regarding new admits? What will help them provide the best and safe care for our new admits? What are you going to be asking for? You have a new admit. What are some of the information that you want to be asking for? That might help you.
Like if the patient's oriented.
Yeah, orientation level, right? Are they oriented? Are they confused, right? What else? What's some most important ones? Information. Huh?
The reason why they can actually.
Yeah, their diagnosis, right? What's their diagnosis? Why are they here? Are they here for infection, a hip fracture, knee replacement? They're here for diabetic. So yeah, the diagnosis is going to be really important. There's a few more things. Right? What's their diet orders, right? That's going to tell you whether you need to bring thick liquids or not, right? They're able to tolerate thin liquids. But also they might know, is the patient able to get up? A lot of times they won't know. They just ask the LVNs. They might have read some notes. They might know it. Just be like, hey, are they able to transfer? Do you know that yet? How much help do they need? You probably don't know it yet. But they may not necessarily know, but they might.
Is there
So those are important.
Or incontinent?
That's important too, right? Yeah. Do we know if she's continent or incontinent? Because when they read their notes, a lot of times the nurses from the hospital will give them information. They're continent or they're incontinent, right? So it really depends on how much information that nurse is picking up. A lot of times they pretend like they're getting the information, but they're asleep. Oh, there you know, and that's all I know.
Okay.
Ain't no times 4.
Very good.
Mobility wise. How
Hmm?
does the patient ambulate?
Yeah, mobility, the ability to transfer
Mobility.
or move around. That's going to be really important as well, right? Okay.
Okay.
All right, let's go to number 3. What 4 levels of orientation should CNA focus on when attempting to assess orientation? What are we looking for in terms of orientation? Person, time, place, and situation, right? Those are orientation 1, 2, 3, and 4. If they know all 4 of those, they're oriented times 4, right?
Oh, I see.
They're all there, right? If they know only person, they're oriented to times 1. They're confused. They're a fall risk, right?
Person, place, time, and what was the last?
Situation.
Situation.
So if you ask them why you here, and if they
Okay.
say, hey, you know what, I'm here for hip fracture, I'm gonna get better and go home,
Oh.
then they know the
I didn't know
situation. Otherwise, we talk about this many times.
Year is it?
No, the 4 parts, you know, when they're
Yeah, yeah.
on that, we
Okay.
talked about the 4, but not this. Person, place, time, situation.
Mhm.
Thank you.
We've never talked about that.
Yeah, we
That
always
would indicate
orientations
how
of them.
oriented they are.
Yeah.
Like that's those
So you
questions,
might say, well,
their
that's
name, what
Mhm.
year it's
So
in.
times 4 is
Okay.
under all there.
All right, let's go to number 4, guys. Name 3 areas relating to room orientation where CNA can provide teaching to new admits. What are some of the things you might want to orient the resident about the rooms?
The call light.
The call light, right?
Very important call light.
Yeah, call light. How do you get a hold of me, right? If you need help, you need to get a hold of me. Push this button, right? That's really important.
Down to
What else?
the bed.
The
mobility,
bed,
the
yeah.
bed.
You want to go up and down the bed there. You know, maybe it's too high, too low. Yeah, bed remote is important. And then how to operate what? The TV, right?
Television.
Yeah. And then also don't forget that they have roommates. You know, you might want to introduce them to the roommates, right? Hey, this is your roommate. You know, this is Miss Jones. You know, say hi. And that might be a good thing for them. All right. Where are we? 5. 5. True or false? Status post hip surgery resident should be assessed by PT prior to first initial transfer.
True.
Is that true? Yeah, that's true. Okay, get them to assess that patient first, right?
Before we even move them.
Yeah. So that's gonna affect your weight, right? If you do an admission at PM, it's like 8 PM and there's no physical therapist there.
Yeah.
You might not be able to get that. Especially if it's a hip fracture and they can't move, right?
Yeah.
Just put a note in there for physical therapist, and you please get their weight tomorrow. Okay, but they need to be assessed by a physical therapist. Okay, what? Now this is different for somebody who's been here for like an infection. They're not here for a hip fracture. You can get that resident and get their weight. So you can't make the excuse, oh, I didn't get the weight because new admit. No. What important factors should we consider upon admission of mobile but confused resident? What are we focusing on a resident that is mobile, able to move around but confused?
Like a fall.
Yeah.
prevent
Safety,
fall.
right? You wanna. So the first couple of days when the resident are admitted, we really monitor this resident for safety, because it's during those days when we implement a lot of interventions, bed alarm, chair alarms, you know, all these fall precautions. It happens within the first
That's true.
24 to 72 hours, right? And so that's why it's pertinent when the first few hours, if you notice, hey, this resident keeps getting up, he's gonna fall down. You know what I mean? That nurse should technically say, okay, let's go ahead and get these implementation in. You know, let's get this bed alarms in there. Yeah. So that's important. All right, guys. And then the inventory list. Obviously, you want to complete those inventory lists, like I said, and have the family member or the patient sign it when they're done. Okay.
John, talking about the chair alarm, Jerry has a chair alarm. It's just not working. He gets off the chair and he has a chair alarm, but it doesn't go off.
Oh, okay. We need to get a hold of Gurley and see if she
Okay.
can get a new alarm. Because a lot of times it's either dead battery or the alarm
okay.
itself is dead. Get a new one.